Yes,
Good
start.
afternoon, everyone. Good afternoon, everyone. Once and all, thank you for joining us today for another webinar by Cannabis India. So today's webinar topic is just a second. I'm sorry. Today's webinar topic is use of Vijaya, in other terms, medical cannabis. In other terms, medical cannabis in women health. So before I introduce our speaker for the day to share her clinical experience and use of Vijaya in women health under Ayurveda, I would like to quickly introduce our company, Canazo India, and what we do. So Canazo India is an Ayurveda pharma company, and we cater to a wide range of products, a wide range of sectors, including hemp-based nutrition, wellness, to medications for indications which include neurological problems such as autism, anxiety, depression, to pain management, to for cancer care, which includes chemotherapy-induced nausea, vomiting, again cancer pain, and also different sectors like hair and care, skin, and pet care. Now, when I talk about our products which are in alignment with women wellness, in keeping in mind today's webinar topic, we have four main products which I would like to talk about. First is Trilokia Vijaya Vati Advanced. We are the only company right now in the market who has a 500 mg per tablet potency. Vijaya Vati is moreover for pain management like renal colic, insomnia, or for digestion issues. Next, we have Bilwa Churna Advanced. It's again a unique formulation which only we are having. This is for gut health, which includes digestion problems like irritable bowel syndrome, to chronic diarrhea. Next, we have Women Wellness. Women Wellness again is a polyherbal formulation, which is for external application. It can be just applied at the point of which targets the point where you have pain, which is your lower abdomen during your menstrual cramps. So it's a polyherbal formulation which includes herbs such as Vijaya, Shatavari, and eucalyptus oil. Next, for chronic pain management, specifically like seen in cases of endometriosis, we have Painate Oral, which is 3000 mg product in 15 ml. So it will have a total amount of 200 mg of cannabinoids per ml. So this is the highest potency you'll find in the market. It's a full spectrum oil. That means it's CBD is to THC, it's 1:1 balance. So, and we are also soon launching another formulation. It's going to be a proprietary blend, a mixture of quite a few herbs, which will cater to the reproductive system of the female. Now, to talk more about the clinical aspect or how it's incorporated in the daily life practice of medical practitioners, we have today our speaker, Dr. Anupama Santosh. Dr. Anupama has more than 2 decades of clinical experience in women health, specifically in treatments of infertility. She's also the co-founder of Shrestha Ayurvedic Center, which is a well-known Ayurveda family clinic in Bangalore and also a top-rated one in Bangalore. Ma'am, it's a pleasure to have you today with us. And now over to you.
Thanks, Arzu. Um, when we speak about Vijaya medical cannabis, uh, we all know it's actually one of the oldest herbs mentioned in the classics. Not just the Brihatrais, which are the older textbooks, even the Lagutrais and the later modern Ayurvedic texts also mentioned Vijaya medical cannabis. Also, it's actually obvious that it was there in our oldest textbooks as well, because after all, Vijaya cannabis is an Indian herb. It is an indigenous herb. Unfortunately, we have not been able to tap the full potential of medical cannabis. I am really hopeful now that it has been legalized and companies like you have started manufacturing better products and better formulations. We will all be able to use the full potential of Vijaya, which is our own herb, which is our indigenous herb. So, like I said, for many years, though it has been mentioned in many formulations in the Ayurvedic text, for many years, because of legal problems, we were not able to use it. And just recently, in a few years, it has been legalized, and also companies like Anazo are also making formulations which are useful to medical practitioners directly in their medical practice. It has become far more accessible. Also, just because the plant is accessible, it's not like we can use it easily, because it needs a lot of purification, processing, shodhana has to be done. So I think now that they are available in formulations which are easy to prescribe and also easy to be used by the patient, the compliance is better. And once the compliance is better, the clinical outcome is also better, the results are better and faster as well, right? So, also when we start studying about medical cannabis or Vijaya, we see that there are multiple uses and benefits of Vijaya. So, when you read, you will see a lot of its uses in almost every system in the body, including just starting from as simple as digestion. Just give me a minute. Sorry about that. So, like I was saying, it's almost encompasses its action, benefits, and uses encompasses almost every system in the body, starting from as simple as digestion, and we know its use in inflammation, pain management, sleep, libido, accelerating wound healing, anxiety and depression, neurological conditions, gynecological conditions, hemorrhoids, eye disorders, jwara, kasa, diuretic, migraine, in IBS. Like it is some kind of ramban which sort of works in every system of the body. It feels like that when you go into the properties and its actions. There are actually several studies which has been done mostly in the US and in the European countries to understand the mode of action of Vijaya. But I would like to highlight these two properties which have been mentioned in Ayurveda, which are very unique to Vijaya. Can you go to the next slide, Arzu? They're very special and unique qualities of Vijaya. They're called Vyavahi and Yogavahi. If you understand these two properties, we can sort of get an idea of why it works like a Ramban individually, and also when it is given with other products, why the action is so fast and so much more efficient. First one is called Vyavahi, which means quick pervasiveness. Without even once it is ingested in the body, Vijaya is ingested in the body, it does not have to get into the digestive process at all for its action to begin. So you can see how much faster it will pervade, it will start diffusing very, very quickly. It's capable of quickly spreading in the body and bringing about the desired effect even before undergoing the process of digestion. This is one very unique quality of Vijaya. And the next one is Yoga Vahi. Its ability to carry another substance to its target area like a vehicle. Right? So I've already mentioned what Vyavahi is. Since this has Vyavahi property, while it is carrying another product to another substance to its target area, obviously it will reach faster and the action will be faster. So we can also consider the action of Vijaya as a catalyst and bioenhancer. I use a lot of this property along with my classical medicines. I'll tell you more about it in my case presentations. Next slide, please. Okay. So, like I said before, like Arsu was introducing me, I have more than 2 decades of experience, and my practice of all these years has been mostly focused on women's health and infertility treatment. And most of the gynecological problems which do revolve around the periods can be very, very challenging because it comes every month, and the challenges also get repeated every month, and women suffer month after month. And most often, whatever medicines we start, the impact of it only is known by the first or the second cycle, and sometimes even the third cycle. It's not just in Ayurveda. Even if you're using hormone therapy or any therapy, it takes a while for these medicines to show action, and we have to wait for the period to come and then change the medication, wait for another period. So I think Vijaya is such a boon for all these conditions where we can expect faster action, even though we may not be using only Vijaya for many of my conditions. So in my clinical practice, I am mostly using it as an adjuvant, but I have seen a lot of difference when I have added this and when I have given similar prescriptions without adding this, because I have been using this for the past 2 3 years. Before that, when I compare it with the clinical outcomes I got in similar cases before adding the cannabis, I can very confidently say that it has made a lot of difference. Let me come to some of the cases I'd like to discuss. Um, can you go to? Okay. This is a female patient of 34 years, married, and she's a known case of endometriosis. She got, I think, grade 2 endometriosis diagnosis sometime back, and she has been managing her painful period with painkillers for a very long time. And when she came to me, her scan showed a right ovarian cyst of 4 centimeter, and she was in severe pain. But basically, she came seeking treatment for infertility. She was so used to the pain month after month. She was not really, in the mind space of thinking that this can be sorted, or this. It was not her priority. Her priority was infertility. When I took the history, her current complaints was severe pain in the lower abdomen, right ovarian pain, and lower back pain. And the pain would start from the time she ovulates, around the middle of the cycle, and it would continue through the period. And when the bleeding stopped, her period would come down, and pain would come, discomfort would come down. It was like she hardly had about 10 days of pain-free period, pain-free duration in the entire month, and this she had for more than 10 years. And her management was only through painkillers. Next slide, please. So since it was a chronic condition, I started with Shodhana. We gave a yoga basti after the menstrual cycle for 8 days in the first cycle. And then I started some internal medicines, Nirgundyadi Kashayam, Gopi Chandanadi Gulika, Eranda Haritaki. Then I started Trilokya Vijayavati, 250 mg per day for the first 15 days of the cycle, and then increased it to 500 mg from day 15 to the completion of the period. This is how I started the cannabis with this prescription. Of course, with endometriosis, which is an inflammatory condition, a lot of time was spent on discussing diet and lifestyle and guiding her through it. There was a lot of elimination diet, like dairy, and we experimented, eliminating gluten and spicy food and vata increasing foods. All that was done. The total duration of the treatment was about 4 months. So when it comes to the outcome, the first month we hardly saw any changes at all. The patient was also feeling discouraged because she started feeling that I'm treating the endometriosis rather than looking into infertility. But as Ayurvedic practitioners, we do not really separate anything. Okay, the cause of infertility itself was endometriosis, unless we get it into some kind of milder form. No, there was no chance of ovulation for her. So I started with decreasing the inflammation along with Shodhana and giving Nitya Virechana to her with Yerenda Haritagi. That's how the treatment started. So in the first month, she reported very little pain relief, but she felt the heaviness in the abdomen and the stiffness in the back had reduced. That was her observation. In the second month, we continued the same prescription, and she mentioned that the pain started only from day 20 instead of day 15. In the third month, pain was felt only during the cycles, and the severity of the pain reduced significantly. She said she was not lying on the bed anymore, and she was able to move around and do her daily activities. So fourth month, we actually, this is a very recent case. In the May 1st week, she missed her period and she tested. She got a positive pregnancy test. And very recently, in this week, I saw her heartbeat scan, and everything is fine. The right ovarian cyst is still there, but it's only about 1.5 centimeters right now. And this was one case where I thought the action of all the medications. You can see I have prescribed several classical medicines. Traditionally, I've started with Shodhana and then moved to Shamana. But I do believe that medical cannabis has helped in getting faster results in this case. Next case, please. The case number two is a female patient, young female of 21 years. She is a physiotherapy student in a major hospital near my clinic. One evening, she came and spoke to me about how she's so tired of taking painkillers, which are hardly working anymore. She was basically seeking treatment for severe PMS, and as a physiotherapy patient, she said she had to stand for long periods and she's finding it very hard to do it. And all these symptoms start 1 week before period, and continues during period, and once the bleeding stops, all the symptoms vanish. This was her complaint, and she complained of mood swings, anxiety, constipation, disturbed sleep, pain in the thighs, period gap reducing. She mentioned that her period cycle was 28 days, and now it has moved to 21 days or 23 days or lesser. And her blood reports also showed iron deficiency anemia, which I addressed along with the other conditions. And she also mentioned she was unable to focus on studies and had memory problems during this 1 week where she had the severe PMS. So the treatment started with a detailed counseling. The girl was staying in a hostel, so there were different challenges when it came to diet and lifestyle. And there was at least 2 sessions where we sat and worked on her diet. How can we improve it? What with whatever is available. No, I cannot ask her to follow an ideal diet when she's sitting in a hostel, but with whatever is available, I could educate her about the Vatahara and Pittahara kind of diet and lifestyle. And later started internal medicines for her. Started with Brahmi Grita, Sukumara Kashayam, Dhagri Loha for her anemia, and Dashamula Haritaki, which is very, very useful during PMS. And then I started full spectrum CBD oil. Since she was a physiotherapy student, it was also easy to counsel her, and she already knew benefits of the CBD oil, and she was very willing to start trying it. And I started just with 4 drops at bedtime. I asked her to increase 1 drop every week till she reaches 10 drops a day, and then taper it back. So a duration of treatment was 3 months, and she was taking it every day, the CBD oil every day during these 3 months. So when she reported monthly, this was the outcome. First month, she said the constipation was completely relieved. She was very happy. She felt light and her digestion improved. Her mood also improved because of that. And in the second month, she said the period gap, which was reducing, now is back to 25 days, though it is not completely back to 28 days at that time. And then she felt in the third month, PMS felt for only 2 days before period and the severity reduced. So after 3 months, I asked her to start taking the CBD oil only 1 week before her period because her period was regular. She was able to start these medications just 1 week earlier, and further advised to take full spectrum CBD oil only from 1 week before, like I mentioned. And she reported better mental health and bowel movements in the subsequent cycles. So I have reduced all her other medications as well, and just asked her to take Dashmula Haritaki Lekhem and the full spectrum CBD oil 1 week before her period, and continue the diet and lifestyle changes as we had discussed, and this has definitely helped her. And we have had several patients from her hostel after this case. I feel that if we can counsel the younger generation about Ayurveda and how it is not so difficult, it's not all kashayam and you don't have to sit and make it in your hostel room. It was a revelation to her to understand that it can be as easy as taking a few drops and taking a teaspoon of this and that. And it was also, if Ayurvedic doctors can sit and speak to them about how to change their diet with whatever they have, how to help them make better choices with food and lifestyle, I think the younger generation is definitely open to Ayurveda. Can we go to the next case, please? Okay, this case, a female patient of 29 years, she had recently moved to Bangalore from a coastal city. So she was already struggling with the dry weather in Bangalore, and she was also eating outside, and she was already diagnosed with IBS from a very young age. So she was in a routine of eating certain foods in her own city, and she was at home at that time, and she was in her own city. And when she moved, she had a lot of problems with adjusting to the diet here, and she had acute episodes of IBS when she moved. Unpredictable bowel movements alternating between constipation and diarrhea, and the symptoms also always used to get worse during period. And she said she never had vomiting before, but now she's also had vomiting and loose motions, bloating, severe colic pain, weakness, and dehydration during the period. And she cannot even forget going to work. She cannot even move from the bed. For the first 3 days, that's how she described her condition. And she also showed some vitamin B12 deficiency in her blood test reports. Next slide, please. So the treatment, like I said, I started with diet guidance because IBS treatment is 70% diet and guidelines, only changing the form of diet they are taking, the time of the diet, and a lot of back and forth about what is working, what is not working. And then I started with Chiruvilvari Kashayam. Then Dadimashaka churna with fresh buttermilk. I asked her to take it about 3-4 times in a day, small quantities mixed with fresh buttermilk and Dadimashaka churna. Then Bilvadi Lehyam. Then I started Bilvadi churna tablet for her. Um, and the duration of treatment was really long, and she's still on treatment, but though we have reduced a lot of her medications. In the first to third month, distress was relieved, but the symptoms during period continued. It didn't make any difference in the first 3 months. From the fourth month, I added Bilvadi Churna tablet because I thought this needed something extra, because she'd also taken Ayurvedic medicines before. She had tried several things, probiotics, everything. So I thought this is a case where definitely medical cannabis will make a difference, and I started Bilvadi Churna after that. And the period symptoms reduced considerably. Vomiting stopped from the fourth month itself, and there was this urgency to pass motions, which was the most troublesome for her, because whenever she went to work, she was in the constant fear that she'll have to run to the bathroom in middle of the meeting, perhaps. Okay, that stopped immediately, and she's been advised to continue Bilvadi Churna tablet only during period, but Bilvadi Lithium is being continued all through the month for her, and she's feeling a lot better, and then so much fear has come down more than anything else, that she can manage her condition, though a cure is a little far away, because she does know that this is a yapya roga and may not get cured completely, but she has figured out the kind of diet and lifestyle which works for her, along with the use of medical cannabis. It has given a lot of relief to this patient. Next slide, please. So, if I want to summarize my clinical observations with Vijaya, so I have consciously compared my prescriptions before using Vijaya and after using Vijaya. So, I can confidently say that when Vijaya is added in the prescription along with other medicines, action seems to be faster compared to the same prescription without Vijaya. Having said that, it is not like I add medical cannabis in every prescription I write because I want faster results. No, it's not like that. So I do start in fresh cases. I do start with other classical traditional way of Ayurvedic prescriptions. When I see that they need much more, maybe help with mental health, also digestive distress, and there are multiple conditions, or also it is chronic and it's not coming under control, that is when I start adding Vijaya into their prescriptions. And I have also seen that, at least in the gynecological cases I see, when the inflammation is high, Vijaya needs to be given every day for a period of 6 to 8 weeks. Though I have seen several clinical studies and I have spoken to colleagues who have said that they've seen results in just 3-4 days of starting Vijaya. In my cases, since let's say an endometriosis cases or case or a pelvic inflammatory disorder, when they come, it's already chronic. So I prefer to start them on a daily basis, and after that move it to on need basis and or SOS whenever they need it only. Then I see that after we have done Shodhana, after we have done all the preliminary work, when we give medical cannabis, even individually later for a migraine or for an IBS, whenever they need it, it works instantly. But when they come for the first time, when I start with only Vijaya, I feel there is a much more need to address the other issues as well, along with other herbs as well. And this question is, consistently asked to me if it has any habit forming patterns. So in every case file, I do make a note. I do ask during every consultation of these patients whether they feel they are used to it or whether they see any habit forming patterns. So far, I have not come across any habit forming patterns when used as per dosage. Okay. And I have also seen that Vijaya is definitely better given after food only, because in some cases I have seen in PMS cases or severe dysmenorrhea cases, some women do not feel like eating at that time because they have the fear of vomiting, and that sometimes they have taken Vijaya without eating anything and it has caused some discomfort in the stomach. So I generally advise them to take something before taking Vijaya. I do see results in dysmenorrhea ranging from 20 minutes to maybe 60 minutes. The action varies from person to person. I do see results, but it is always better to give it after food. Also, as the properties have been mentioned that it does increase pitta in the body. So if it's already a pitta prakriti person and they already have amla pitta and they're vomiting, having loose motions, we better take care and give it as an after food dosage only. Overall, in my practice, Vijaya has definitely been a boon to patients, and I have seen better results, faster results and more effective results with while adding the Vijaya in various forms. As I say, as I've already presented in the cases, I have used it in tablet form, I have used it in churna form, the full spectrum CBD oil. Find it very convenient because companies like you have been making it in a safe way. It's not something we can sit and do it in our clinics. So and I also think the compliance is better when we have modern formulations like tablets and capsules, and I can't emphasize this more, and roll-ons and stuff which women can carry around and can use it easily. Yeah. uh, these are my observations, in short, with medical cannabis in women's health and infertility treatment. Thank you.
Thank you, ma'am. Thank you so much for sharing your clinical experience with us. I think in all we can say that Vijaya is one powerful herb which can, cater to a lot of problems, including, women wellness problems, or to, pain management, for neurological problems, for delirium, whatnot. Ma'am, I think now we'll take a few questions which the audience has.
Sure.
So, ma'am, one of the problem is there something regarding migraine problem most of the ladies facing in daily basis throughout their lives?
Definitely. Actually, Vijaya is indicated in migraine, but it is not something that they should experiment on their own, because I would definitely recommend the patient to see an Ayurvedic doctor and comprehensively treat the condition. But along with Vijaya, the results are very promising for migraine.
And just for the audience to know that we also do have a product for migraine. It's known as migraine aid for external application as a roll-on. As ma'am has mentioned, that now companies like us have roll-ons, which is very easy to carry, pocket-friendly.
Yeah.
Ma'am, is there any other question?
Is there no any other question?
Okay, so ma'am, okay, now I think the two questions which I had was one, any contraindication of safety measures to be taken along with medical cannabis?
That's an important question. So, while we are taking history, we should definitely take the history of whatever medications they are already on. And most often, the insomnia patients who are on sleeping medicine or hypertensive medication, we should definitely take care when they're doing it. And if my patient is on a sleeping medication already, I will advise them not to take both at the same time and ask them to stop the sleep medication and try the cannabis instead. And even with antihypertensive medication, we have to be careful while we are prescribing medical
Hmm.
cannabis. It is better to understand it's all right to stop it or space it out. And in these two conditions, I would definitely warn that we have to take care.
Ma'am, one last question is: can medical cannabis be introduced to pregnant or lactating women?
No, as far as I know, there have been no studies about
Hmm.
safety during lactation and pregnancy at all. Even in my patients, the minute they miss their period, even before they take a UPT, I ask them to stop the medication once they have conceived. No, I would. It is contraindicated. Medical cannabis is
Contraindicated.
contraindicated. Yes.
So absolutely no case we can give if a person is pregnant, if a lady is pregnant or it's lactating.
Everything has an exception, but in onco cases, I have seen patients taking medical cannabis that has to be, but in a public platform like this, I would say it is contraindicated. Yeah, and the doctor can decide in dire cases
Based on the
where
current intervention and what is needed as per the case
mostly
detail.
in terminal illness and other cases, I have seen it being used, but I do not want to make a public statement
Of
about its
course.
use in lactation and pregnant women.
Ma'am, any common side effect which people should be careful about seen after consumption of cannabis?
So in some cases, when I have started, I usually start with a night dosage. Okay, just to make sure that if they are driving in the in the morning, so then after a week, I ask them to report back, telling me if there any changes in alertness or any symptoms they may feel. I have seen that, and after a week, I start a BD dosage. I don't start a BD dosage from the beginning. And secondly, like I already mentioned, people who have had ulcers before, or gastritis conditions, who have been on pantoprazole for a very long time, all those cases we definitely have to treat that first, and without giving Vijaya directly. Okay,
Understood.
yeah. So I safely give it after food, even if it is given in the morning or at bedtime, and not with too much gap between the dinner and
Hmm.
bedtime, so that the pitta is not increased at all. Okay, that has to be taken care of.
So usually, ma'am, it's micro dosing. Like you start with a minimal lower dose, and over the
Yes.
period of time, you increase gradually depending on the response.
Yes. Just like every other medicine, no,
Yeah.
I mean, it has to be individualistic. I mean, that is why Vijaya is an Ayurvedic drug. It will work. I mean, how much is needed, how much it will work, how much will it take to get the desired effect? It is something we have to wait and watch, and constant monitoring and reporting is very, very important when we start using medical cannabis in our practice. And also make sure that how much is being prescribed, and they don't come to the counter and buy more because they are feeling good. And it has to be done in a very, very methodical, structured way, right? When it becomes unregulated is when it causes more harm than benefit, and it will also take away the benefits from so many people who can use it. For years, for 2 decades, we didn't have
Yes.
these products at all. Right now
Yes.
that we have it, I think we have to use it with a lot of responsibility.
Yes, correct. Like a safe use is very important.
Exactly.
Consulting with your doctors, it's a prescription-based drug. So any
Yeah.
person who wants to consult, it's very important they consult with the doctor before taking or consuming the medication. Now, one question is, how is Vijaya helpful for diabetes?
Okay, if you're already on any other medications, and if there is
Hmm.
any painful condition like a diabetic nephropathy or a diabetic neuropathy, Vijaya can be safely added to their prescription, and it shows definitely better results by reducing the inflammation, also by making the nerve endings more active. There is good use in diabetic neuropathy, definitely. But individually, I will not say, okay, take Vijaya and your diabetes will be gone, or all your symptoms of diabetes will be gone. But as an adjuvant to your current prescription, along with the diet and lifestyle changes, you will definitely see better results when Vijaya is added properly by a doctor in a very monitored dosage. Like I already mentioned, but it is useful. It is definitely useful in even chronic diabetic patients. In diabetic neuropathy, I have given, even in chronic cases, where in old age patients also, they have found a lot of results. And again, it has to go along with the diet and the prescription. Now it has to be a comprehensive prescription.
So the treatment should all cannabis drug is prophylaxative or cure in migraine.
I am not sure what you mean by prophylaxis. Do you mean that I may get a migraine, so I will take it now so that it will not come, or I am not very
I guess
sure.
the cure is anyway, I think it depends on the individual case. Like we
Yeah.
cannot guarantee whether it can be cured. It depends
I
on the
think,
individual patient history, the current medication they're on. So many factors to consider while giving any medication.
I am guessing the question is that in a known migraine patient, can it be given so that they do not get it later? Maybe something like that. But that is not really necessary. We don't
Hmm.
really use it for that condition as a prophylactic. I don't think Vijaya needs to be used at all. The other factors, the root causes of migraine, has to be treated first. And when they
Hmm.
come to us, the migraine is already so much that we have to address the pain, right?
Of course.
So for
Yes.
that part, while we are treating the root cause and all that, we have to give some relief to the patient. So I add this migraine is one of those conditions I add it earlier than later, because there is so much pain and so
Pain.
much
Hmm.
stress, vomiting, and not able to come out in the sun. So many cases. So, but when I start the treatment, probably cannabis will be the one of the first one I will withdraw once they are feeling better, and use
Better.
it whenever it is needed, and not to be used as a
SOS.
prophylactic or a
Hmm.
preventive. It is not necessary. Or maybe a roll-on can be used, not
Hmm.
internal.
External application wise.
External application whenever there is a migraine headache at that moment.
All right. I think, ma'am, that answers all the questions. When do you see Vijay getting legalized in India? So actually Vijay is already legalized in India. I think that is why we're having this webinar. We have all products approved under Ayush. When it comes to the medication part, it's based on the Vijaya leaf extract medications and the leaf powder, which is usually done to the traditional way, Shodhan. So I think that part we have covered. So ma'am, I think that covers all the questions.
That's great.
Yes. So thank you so much, ma'am, for sharing your experience with us and enlightening us about how Vijay is actually being used in daily practice. If any doctor or any patient wants to know more details about it, they can just contact us or ma'am.
Sure.
Thank you.
Yeah, thank you. Thank you, ma'am.
Thank you. It's a pleasure. Thank you.